One more minute to go, and Dr. Session is here bright and early, all ready for us. And it's time for the COVID update, which is brought to you only on Hospital Radio Bedford and on HRB Breakfast. And we are live on Facebook as well. Good morning, Dr. Session, and welcome to the show.
Good morning, Opoku. It feels like such a great morning for some reason, yeah, it does. So
it's not, um, the sun's not really shining, but it feels really nice. I like it.
Same here. I know we woke up with the same feeling. I guess it's because we're in this pandemic and we're just living life day by day, and I think we've sort of it's that feeling that we've obviously overcome quite a lot of obstacles and challenges, and that that we've seen it through and we are going to continue to see it through. And I think for me it's like it's a like watching the Olympics the other weekend. It's about together we are all stronger. So the more and more we all work together, whether it's just in our local communities, in our workplaces, in our families, wherever we are, if we're going to do it together, we are going to be stronger together and we are going to overcome this. So I think that's the feeling I've got. Yeah.
Absolutely. Same here. Same here.
Yeah.
And this morning, I was going through the news, and there's not that there's not that much news on the COVID situation, but one that is on and that really caught my eye is the self-isolation stuff. They say the self-isolation ends for double jabbed and under 18s.
Yeah.
So I'm double jabbed, so that means that I don't even have to self-isolate if I come into contact with somebody who's tested positive. The only thing I am advised, and even that is not compulsory, advised to do is to take a PCR test.
Yeah.
But the stress here is that it is not compulsory, so I can decide whether I'm going to do it. So what's going to happen? What? Can you explain it to us?
Yeah, well, so I mean, I think it's because if people are double vaccinated, obviously the risk is lower. So you're less vulnerable to get the COVID-19 because obviously that's the reason that the vaccines were being promoted. So if you the there's obviously a lesser risk of anyone if they have the both vaccines that they are going to be at risk of getting COVID-19. So therefore, if you do come in contact with someone, so for example, if you come in contact with someone and you've been vaccinated, whereas someone else who hasn't been double vaccinated comes in contact with someone with COVID-19, obviously the risk of getting it would be higher with the person who doesn't have both jabs. So I think that's where so it's all evidence based and research based, so that if people are vaccinated, you don't have to isolate. And I think that's fine. I mean, because there is the reason why, I mean, even when I think Freddie and I were talking, and there's certain times we would just say something and they say, no, but don't worry because you've been vaccinated. So I think it's that sort of reassurance that, okay, you've been vaccinated. It sort of cuts your risk down of getting COVID-19. But having said that, Opoku, we do know that people who have been vaccinated have got.
Actually, I know somebody who is self-isolating right now, and that person has had 2 jobs.
Yeah.
And tested positive. I must say though that that this person is quite elderly, and she's got some underlining health issues. But I must say that she's fine. She's not feeling anything really. She knows she's positive, and she had a few coughs here and there, but that's it. That's it.
That's good to hear. So so that's exactly my point. But that's good to hear that she's okay. So probably if people do get infected or reinfected, or if they have the jabs, then it's obviously going to be sort of a milder form of the COVID-19 infection.
But is there a possibility of these people, infecting others if they don't self-vaccinate? For example, if I've had the double jab and I have it, and I come into contact with somebody who's tested positive, and I do not self-isolate, and I test positive, or I I'm positive, even though I haven't tested, and I don't feel anything really. Is that can I possibly infect somebody who hasn't had a double jab?
Yeah, that's a very good question. And yes, the answer is yes. You can infect the other person, which obviously because COVID is so contagious. And yeah, I'm not sure about these, obviously the guidance, they're basing it on evidence base, but as we've just like sort of understood it, it's possible that even if you are double vaccinated, you can get the virus and then you can spread it. So I think in terms of not isolating is a bit of it would be a bit of a concern, I would say.
Yeah. And I would say that even though we've been advised not advised, but we've been told that you don't need to self-isolate if you've had both jabs. I would say if I were to come into contact with somebody who has tested positive, the first thing I probably would do is to take a PCR test.
Yes.
Even though it's not compulsory. And if I do take a PCR test and I test positive, I am going to self-isolate.
Yeah.
So that I don't infect others.
That makes sense, and that's really sensible, isn't it? Because you know that getting tested is important to see whether you've obviously gotten reinfected and also or sort of got the infection, and also that you want to try and help others and obviously reduce the risk if you do contract it, so that you would prevent others from getting it. So I think that's a sensible approach, and it's like when we had Freedom Day and they told us that we didn't have to wear masks. So a lot of people still wore masks. So I think it's going to be the same with this new, obviously, guidance that you don't have to self-isolate if you've had both vaccines. So I think it's going to be every person is going to decide for themselves what's going to be the best decision. And I think if you're not sure, just call up your GP, call up your healthcare professionals, or speak to other people that are more experienced. Because I think just talking about it through with someone, will help you make the right decision. So yeah, it's obviously these are things that are happening day in and day out. Um, so I think it's important that we do try and work through it. I don't think there's a hard and fast rule that no, definitely don't self isolate. I think that guidance is there, but if you feel there is a huge chance you might have contracted it and you've got both jabs, then I think like your friend is isolating and obviously has the infection now. And imagine if he or she was actually going around then spreading it. So yeah, I think that's sensible. And as we know, the numbers are still going up. So yeah, it is best to be careful.
Are there any countries of interest at the moment in terms of the COVID?
I think there are still a few. South Africa, I know, is the numbers are going quite high and people are still dying.
Are they?
Yes.
Are the numbers going high in South Africa again?
Yes. So I think, they're in the third wave. The numbers are going high. People are dying. We're hearing about it daily. That obviously in Johannesburg, it was really more prevalent, but it seems to be in Durban as well. Certain areas in Durban, Phoenix, Chatsworth, and other areas, Overport, and some other areas in Durban, Tongaat, all these areas.
Where in the traffic light system is South Africa to the United Kingdom? At the moment.
So in terms of the number of figures, is they're number 17.
I'm talking about the traffic light system, like the traveling thing.
Yes, I don't. Because they're on the red list because I think
they're still in the red list.
I think they're on the red list because of the South African variant. Yeah. So they say that SA records, as of the News 24 headlines, SA records 10,139 new COVID-19 cases, majority in KwaZulu-Natal. So they've hit the third wave. So it seems that the third wave obviously is now in KwaZulu-Natal, which is Durban, where I come from. And the province has had in the last 3 consecutive days more than 3,000 new cases. So it's getting really, and then Western Cape as well, Johannesburg. Um, and Dr. Fauci actually has said, make it easy for everyone to get vaccinated. So he's saying a lesson for South Africa. So it seems obviously South Africa, obviously they started off quite late with the vaccination. Yeah. So he's saying the lesson, this is a lesson, one of the lessons for Africa, South Africa, and Southern Africa is make it easy for everyone to get vaccinated. So obviously there's a concern that only 1 in 10 people in South Africa have received the vaccination.
Oh, that's not good.
Yeah, and they're still trying to convince people to take it. Whereas Dr. Fauci has said in the US, 62% of the adult population have been vaccinated. So yeah, so it seems obviously there is concerns, and healthcare workers are struggling under the pressure of the third wave. So South Africa is in the third wave, but they've handled the pandemic well. So I'm not that concerned. I am obviously concerned that the numbers are still rising, but I think if people start to adhere to the rules again of self isolation, wearing masks, hand sanitizing, maintaining social distance, and obviously looking at the events that they're having, because I know in South Africa, whilst we were isolating quite a bit, and we cancelled lots of plans. We were not having any big gatherings. South Africa, on the other hand, I know people in Durban and all over Cape Town, they were still having large gatherings, and it's like a culture thing as well, isn't it? I know the barbecues, the braais, and just getting together, having parties, and yeah. So I think it's a whole culture thing. So people need to change, obviously, and adapt to the third wave. But I think South Africa will be fine. They will pull through it. Now that they're aware that they're in the third wave, they are going to be able to overcome it, and they've done pretty well in the whole, in terms of the world. Yeah. So I wanted to say about Primark. I don't know whether you saw the news, but Primark
No,
is
I haven't seen it.
so Primark is offering in-store vaccinations. I was curious to hear.
No way.
Yes,
Really?
yes, I was curious to hear what your thoughts.
No, I haven't seen it. I probably need to search it now.
Yeah.
You
So
know,
BBC News, yeah, BBC News shoppers.
Primark.
Yeah. So
Let me
shoppers.
just type it in and see what we get.
Okay.
Primark
Okay, you go for it. Yeah.
vaccination.
Yeah.
Hang on.
Yeah.
Vaccine nation. Can't even spell anymore. Let's see. Oh, there we go.
Yeah.
It's news about Primark. Wow, it's so cool. So here we go. It says that shoppers are being offered the chance to get a COVID vaccine, a COVID vaccination at Primark's flagship store in Birmingham. Is it just that one?
It seems like it. It seems like it's obviously we're going to. It will probably be adapted and implemented in other Primark stores.
Other Primark. Oh, okay. Is it anyone over the age of 16 and needing their first jab or their second, where their first vaccine was more than 8 weeks before, can visit a walk-in clinic? So it's a walk-in clinic. You just walk in and then you get it.
Yeah.
Right. The University Hospitals Birmingham NHS Foundation Trust thanked the chain for supporting the vaccine drive.
Yeah.
So they can receive the Pfizer jab until 4 p.m. on Sunday and between 10 and 7 on Monday. This is fantastic. I have a feeling that other stores are going to toe that line. They're going to start offering this vaccination.
Yes, and I think Primark plays an important role, because a lot of people in the UK do shop at Primark, and it's the clothing is great.
Especially the youth.
Exactly, it's targeting that group of people that obviously, I think they're being creative and using whatever's available. So I think it's good. So the younger people, younger generation, that are obviously influenced by fashion and looking good, So it's and they've got great clothes, Primark, and everyone I know shops at Primark. They shop at other places, but at the high end street stores. But then we all do shop at Primark as well because and kids love their clothes. I mean, my kids love some of their clothes, so we do shop there. So yeah, so and
my daughter would, I mean, like, her mom will get stuff from Marks and Spencer's, Debenhams.
Yes.
I don't like when she goes to Primark to shop.
That's it. I think I think it's like the young generation do feel that.
Absolutely.
So it's the same with us. So
but they do have some nice clothes, though. To be honest.
Yeah.
They do have some nice stuff, oh wow! I like this the vaccination thing they're doing.
Yeah,
I think it's great. It's great.
I'm not surprised by your reaction, but yeah, no, that's good. It's good to see that obviously they're making it more accessible for the vaccine because what we know is there has been a good, rollout of the vaccine in the UK. But I think from the news headlines, they're saying that the second jab, obviously, they haven't had. Um, so concern over the lack of second jab uptake ahead of winter. So it seems that obviously the second jab has not
so
been.
the government is trying to push that people get the second jab before winter because then that's very true because come winter, the winter months they are the flu months, aren't they?
Yeah.
People start sniffling and all that. So it will be good to have both jabs before winter, and then that way you're covered.
Yeah. So the statistics as of the 13th of August, at least one dose is 47,254,399, which is 70.9%. So this is the world data for the world. And then fully vaccinated is 40,372,982. So that's 60.6%. So I was trying to see the statistics just in the UK to have an idea of how much we've just had the vaccination. So that's, obviously the figures are there. It's between 60 and 70% that obviously people have taken up the vaccine and haven't. Yeah. So in terms of the so it's giving me, I'm trying to get the up-to-date dose, sorry, the date.
Don't worry, just take your time.
So it's saying, yeah, it's not giving me, but I'll try and get it just now. But yeah. So at least one dose. It's saying, yeah. Oh, so that is actual. I think that's the figure for the UK. The 60. I don't know. No, that can't be. But I will have a look and see. I'll try and see. That was a world figure.
If it's 40 million and all that.
Yeah, that's a world figures. I think I'm getting it. Yeah, that's a world figures. So, but I will get the figure for the total vaccination, so we can talk about that.
Tomorrow or something.
Yeah.
Well, unless we get it today, then we'll talk about it.
Yeah, I don't have that. That's a world figure that I've got, but we'll have a look at the rest of the figures. But so that was the one story that actually caught my eye. There were a few other stories. So it was about the vaccination and obviously Primark rolling out the vaccines. Oh yes, so they're saying that going out, people going to nightclubs, you need to be fully vaccinated by the end of September. So everyone that's obviously thinking of going to nightclubs will need to be vaccinated, fully vaccinated. Yeah.
So it doesn't matter if you've got a negative PCR test, does it?
It seems to be no. It seems to be you have to be fully vaccinated.
Vaccinated.
Yeah.
So but that's one incentive to get the youth to get the vaccination because they would like to go clubbing, wouldn't they?
Yes.
And if you're not fully vaccinated, you can't go, so you will have to get it.
Yeah.
Somewhere. It's a good thing we've got the NHS that that gives you your because on the app you can go on it and it will tell you it will inform whoever wherever you're going to about your vaccination status.
Yes, the NHS app is good. Yeah.
Yeah, we went to watch Motown the musical.
Yes, you said, yeah.
In the theatre in Milton Keynes, and then there's a long queue, and you have to show them. You have to prove that you're either fully vaccinated or you show them a negative PCR test in the last 24 hours. So, and everything is on there on the NHS COVID app.
I think that's really good, isn't it? I think that's good to have the app. And, if you are vaccinated, get it on the app. And so wherever you go, you can just show that.
I was actually a witness to one person being turned away.
Because of that? Oh.
Well, I don't know exactly if the person didn't have, wasn't fully vaccinated, or the person didn't have a negative test, or if that person's negative test was, longer than, or was it a 24-hour one? I don't know what the situation was, but I noticed that we all saw it, that he was told, "I'm sorry, you can't go in."
Yeah.
Yeah.
So that's unfortunate. So it's quite strict, isn't it? I think it's going to be like that for a lot of places, as we spoke about the digital passports globally that will be implemented. France, all these other countries have started to implement it. And so the NHS app is another way of, proving that you've been vaccinated. So unfortunately, if you don't have it and if certain places require it, you will be turned away, as Opoku's just told us a bit about the story. Because I think we read about the digital passport in Paris, where people were actually being turned away if they didn't have the digital passport, saying that, and the NHS app was not the app. They needed to download the specific app for France.
Yeah, I have downloaded that one.
Oh, really? Well done. So when you're going to France soon?
I did.
Take me with.
The day we talked about it, that same day, I just said, well, I might as well just download it. So I did it. I did it.
Well done.
The other thing I wanted to talk about is, and this is really true, this person we know.
Yeah.
I'm not going to mention where she works, but she's got a letter to say that if she didn't get vaccinated, she would have to stop working there.
Yeah.
And some people are thinking, because we discussed it amongst ourselves.
Yeah.
Some were saying, "Oh, that's too harsh, and it is her right not to get vaccinated, and this and that." And some others were arguing that it's a very sensitive place where she's working, and if she's not vaccinated, there's no proof really. There's no guarantee that she's safe enough to not to infect others and all that if she caught COVID. So what's your take on this one?
Yeah,
I know it's a personal choice. People, So whatever your opinion is, let me do a disclaimer here that it's just our personal opinions, and this has absolutely nothing to do with trying to get you to think this way or that way.
Yeah. No, thank you for that. I do feel unfortunate that our person we know possibly has been put in such a difficult position, and I think we all could be put in such positions. Unfortunately, we've taken the vaccine, so we're not in that position. But I think if someone said, "Oh, you had to take the vaccine, or you can't work," I think it is a personal choice. We all should have that choice to be able to make that choice of whether we want the vaccine or not. And irrespective, and I think each person, when you make that decision and you continue to work, I think our employers should respect that. So I think all institutions and employees should respect that if people don't want to take the vaccine, for various reasons, they could be health reasons, they could be, so many other religious reasons, or, other conditions that we don't know about, that people don't want to take the vaccine. So I think we shouldn't be forced into it. So I think it's quite unfortunate. And I agree with what you said.
That's my opinion as well. I don't think we should be forced into it.
Yeah.
At the same time, we'll also have to look at terms and conditions in certain workplaces. Maybe they laid it out, you know. I don't know. I don't want to speculate because I don't work there. So
yeah.
Anyway, that's just by the by. It's 20. We've got 6 more
I
minutes.
know when you just do the figures. But before that, I know the time's just gone, but I was just going to say, they say COVID risk from trains could kill hundreds, rail chiefs warn. So I just wanted to put that out there on the Monday morning. But they say,
Say it again. Can you
yeah.
repeat it, please?
So the chief head, Oliver Gill, the correspondent, has said that in his headlines, COVID risk from trains could kill hundreds, rail chief warns. So seems to be that there's obviously commuters going on the trains. It's going to be a risk. They're putting themselves at risk. Um, so I just wanted to put that one out there. And there was another one where, which obviously new COVID strains or new COVID strains and variants would set us back a year, experts warn the UK government. So we can discuss more about that tomorrow. But it seems obviously the reason why we are still in the third wave, why we're still having this broadcast of COVID-19 is because of the variants, and obviously there's also concerns with commuters. And I think the UK depends largely upon train transport, so rail transport. So it is a concern. I was just going to say we were in London the weekend, and trains obviously were packed. We drove into London, but London was packed, and I think why I was feeling so good was because everything seems to have gone back to normal. They were actually at the hotel we stayed in. There were two weddings, two very large weddings. So, and it just felt like we were like back to normal. It was like back to normal life where people are celebrating and enjoying, and and even we went to the light center, the Sukya Mai Curry Center, and but as I always say, they're very good with social distancing and wearing a mask, and they had their own mask. They had the gel. You have the gel in front. As soon as you enter, they take your temperature. So it was all very controlled, and so the Light Center does a brilliant job. There's a church next to it, and I went into the church, and strangely enough, the church, not everyone was wearing a mask. I was the only one wearing a mask, and they had hand sanitizer, but they were not checking temperatures. So I think it varies from place. It varies from place to place. So I just wanted to put it out there that obviously, yeah, I mean, London is gone back to normal, and I'm not surprised why people are obviously concerned with the train. So that's something we can talk about. I know you want me to get on with the world meter. Yeah. So, and yeah, the headlines. Um, Obviously, in terms of the figures, remain still a concern globally. So, as of today, the 16th of August, the Worldometer figures are 207,995,820 positive cases and people that have coronavirus globally that have had. Total number of deaths are 4,374,966. Total recovered are 186,466,822. So the top five figures remain the same, with USA number one with 37,466,718 positive cases, with 637,561 deaths. India number two with 32,225,513 positive cases. And India, new cases are saying 338. So it seems to be that India, the cases have gone down with with 431,674 positive cases and deaths. Number 3 is Brazil with 20,364,099 positive cases with 569,218 deaths. Number 4 is Russia with 6,600,836 positive cases with 170,499 deaths. France is 6,471,035 positive cases with 112,656 deaths. UK 6 million, number 6 with 6,267,437 positive cases with 130,953. And I am predicting that UK is going to move up.
To number 5.
Yeah, to number 5. And South Africa 2,605,586, number 17 in the world, as they battle the third wave with 77,141 deaths. So they've done really well still, but it's still a concern. Ghana number 103 with 110,710 positive cases and 922 deaths. I was just curious, when you went to Ghana, did people, we can talk about it tomorrow, but when you said you're coming from the UK, were people quite like concerned that you've come from the UK and
yeah, a couple of times somebody would say, "Oh my God, UK, you guys got high numbers."
yeah,
But apart from that, people weren't really, because the fact also is that they know that you get a test before you get there.
Yeah.
And then you get tested at the airport. So once you're clear, there's not that it's not that a big deal anymore. But then they do talk about the high numbers in the United Kingdom. They see, the numbers we've got in the UK. We think it's nothing compared to probably India and the United States and Brazil and all that. But in Ghana, they see it like, oh my God, you've got huge numbers, That they can't believe that at one time there were over 600 people dying in one day.
Well, I mean, they've done so well, so their figures are so low. So I'm not surprised. Yeah, and the total 24-hour figure, I was just curious. That thought just popped in my head. 26,750 new cases with 61 new deaths. So I think, yes, we are still obviously, I think there's going to still be a concern in the UK in the days to come, in the weeks to come. I do predict the numbers are going to go up and maybe there might be another lockdown or something sort of with restrictions at some point.
Please don't predict another lockdown.
Maybe, I'm not sure. It could happen, but I'm just keeping it open. I think we need to be prepared.
You know what your predictions are like.
I think we just need to be prepared, and we should talk about the diabetes. I think the diabetes and obviously what's happening in India, as we spoke about last week about India.
I did say I was going to get in touch with Lyndon. I must confess that I haven't done that, but I will do it. And see if we can get him on the show tomorrow. If it's not that, if it's not busy.
So in the context of obviously post-COVID, people having steroid treatments and then getting diabetes as a result, and that's happening in India at the moment. So it will be interesting to hear about that. Because if it's happening in India, I think it's happening worldwide. I don't think it's something isolated to India. But thank you so much. Have a fantastic day. Let's spread the love and not the virus. Lots of love to everyone.
Thank you. God bless. And
God bless. Thank you.
Let's